Welcome. This module will help you better understand stretching and body work in the water. This module will also help introduce the world of aquatic physical therapy. You are going to learn how to use the water to stretch different areas of the body. My name is Kennedy Van Ravestein, and I will be co-presenting with my good friend Katherine Lamberton. We are both third-year doctoral students, and this module is part of our doctoral project.
We want to give a shout out to our school, Murphy Deming, located in Fishersville, Virginia, in the heart of the Shenandoah Valley. This is a picture of us with our doctoral project advisor, Dr. Bess Maxwell. Before we get started, we would like to introduce ourselves. Kennedy and I have been friends for the last few years. We bond over Netflix, ice cream, coffee, tacos, and sushi. We love playing with our dogs, Kovu and Knox, who are also best buds. Kovu is a charcoal lab and Knox is a yellow lab. We are in our third year as DPT students.
We enjoy swimming, soccer, tanning, and being at the beach. Katherine is obsessed with Disney, but that's for another presentation. Now that you know who your speakers are, let's get started.
There are 5 modules in this series. The entire series is designed to help educate DPT students about aquatic physical therapy. You are encouraged to take a look at the other modules. The modules in this series are properties of water and the effects of immersion on the body, aerobic endurance and anaerobic training in the water, resistance training in the water, aquatic stretching and body work, that's this one, and then balance, gait, and function in the aquatic environment.
The course objectives include prescribing fit VP parameters for stretching, discussing the benefits of using the water for stretching and body work, explaining how to perform 4 upper extremity and 4 lower extremity stretches in the water, describing the purpose of aquastretch, Baudrillard's ring method, and Watsu techniques, and being able to design a stretching plan for a patient in the water.
Stretching is defined as increasing range of motion either through active or passive motion. When we think of increasing range of motion, so many structures are involved, like joints, muscles, tendons, ligaments, fascia, nerves, and blood vessels. In the picture, you are reminded of the many soft tissues that surround the knee. It is important to realize that stretching and bodywork can change many tissues. Bodywork is defined as intervention by a therapist using skilled touch and positioning to bring about changes in soft tissue or joints. As you will see ahead, both stretching and bodywork can be done with the patient passive or active.
Aquatic stretching and bodywork can be used across all generations and with a variety of impairments. Populations ranging from pediatrics to geriatrics can benefit from stretching in the water. Impaired movement due to tissue tightness, spasticity, or pain accompanies hundreds of conditions. The water's buoyancy, resistance, and warmth can help improve tissue extensibility, decrease spasticity, and relieve pain. Pictured is a child with cerebral palsy being stretched in the water. The therapist is demonstrating how the warm water increases tissue extensibility and the buoyancy allows the patient to float and relax her muscles. The other picture is a therapist with a geriatric patient. The patient has an ankle weight, which we will discuss later, but the water is assisting in increasing extensibility of his hamstring.
There are many different properties of water that can assist stretching and bodywork. Using the water helps to offload the bones, joints, and ligaments while also increasing tissue blood flow. In the water, there is an increase in parasympathetic input that reduces spasticity and increases relaxation. An important factor with the water is water decreases the effects of gravity and decreases our weight-bearing status. At waist level, 50% of the body weight is removed from the patient, and at the xiphoid process, 75% of the body weight is removed from the patient. To gain further information, be sure to watch the Properties of Water module.
Something to keep in mind when working with patients with different conditions is the temperature of the water. If your patient is diagnosed with multiple sclerosis, they will be more comfortable in cooler water less than 90 degrees Fahrenheit. Patients with multiple sclerosis experience an increase of symptoms in warmer water. On the other hand, patients with spasticity, high tone, pain, and tight musculature will enjoy and benefit from the effects of warm water.
Many patients can benefit from aquatic therapy, But if your patient is uncomfortable with the water, do not require them to do aquatic therapy. We want our patients to be comfortable. The therapist needs to ensure safe transfers into and out of the pool, which may include the chairlift and utilizing stairs. Make sure your patient is in the correct depth of water for the type of stretching you want to perform. Also ensure a flotation device is available if needed for proper positioning during stretching and for safety. Make sure you educate your patient on the proper use of flotation devices to avoid risk of injury. Patients with open wounds should not enter the pool for therapy due to risk of contamination and infection. Most pool areas and locker rooms have wet floors that are slippery. You can recommend that your patients wear shoes while walking on the pool deck. Refer to the module on properties of water for further information.
Stretching has many benefits, but done incorrectly, it can cause injuries. Injury is preventable when you know the contraindications. During your stretch, you want your patient to increase range of motion to a max range that is not painful. Your patient should feel a pulling sensation in the muscle being stretched. It won't necessarily be comfortable, but it shouldn't be painful. If it is painful, you should reduce the tension of the stretch. If your patient is not feeling a stretch, then increase the range of motion. The contraindications to stretching are joint instability and hypermobility, bony block, recent fracture and incomplete bony union, acute inflammatory or infectious process, sharp acute pain with joint movement or muscle elongation, hematoma, short and soft tissues that provide necessary joint stability, or for a patient with paralysis, muscle weakness to perform specific functional skills. There are two types of contractures that you may encounter with patients, fixed and flexible. Remember that stretching can increase range of motion with a flexible contracture but will not improve a fixed contracture. A fixed contracture prevents with the muscle in a rigid position appearing stuck. The patient and therapist must accommodate to the deformity because stretching will not fix the issue. Stretching can benefit a flexible contracture by reversing the soft tissue restrictions. If the patient is using buoyancy equipment like noodles, make sure they know how to properly use the equipment to avoid injury. If a patient has vertebral instability or vertigo, you don't want to perform any motions that would worsen the condition.
What is the Fit VP model? Hopefully you have an idea of how to create and prescribe a Fit VP for patients on land. If not, we will give you a quick refresher. A Fit VP is an exercise prescription designed in terms of the frequency, intensity, time, type, volume, and progression. These parameters are used to correctly dose a patient with the right amount of exercise depending on their individual needs. The Fit VP model can also easily be used for patients in the water. As we continue through this module, we will continue to discuss Fit VP, and by the end, you'll be able to design a Fit VP for stretching in the water. Based on the ACSM guidelines, here's a typical Fit VP for stretching that can be utilized on land or in the water. For frequency, 2 to 3 days per week of stretching the major muscle groups. Greater gains will be attained if done daily. The intensity, stretch to the point of slight discomfort or feeling of tightness in the muscle. For time, 30 to 60 seconds of static stretching holds for older adults, 10 to 30 seconds of static stretching holds for most adults. The type of stretching, volume, provide a total of 60 seconds of stretching time per target muscle group for any stretching method utilized. And the progression, 2 to 4 repetitions of each stretch is advocated. This is physiologically what works for stretching, and it does not matter whether you are stretching in the water or on land. Being in the water does not change the parameters for stretching.
What is PIPQFT? PI stands for Performance Indicators. The 4 indicators are fatigue, pain, quality, and tolerance. This is a tool physical therapists should use to monitor their patients both on land and it applies in the water. Observing these indicators will show how your patient is responding to therapy. Ideally, we want our patients to have no pain, good quality, no fatigue, and tolerance to the exercise, water, and the position. Any signs indicating pain, decreased quality, fatigue, and decreased tolerance to therapy activities indicate the activity should be stopped and adjusted. For example, you will see that some stretching and bodywork is performed with the patient floating supine. Some people get dizzy if they move too much or too fast in this position.
Dynamic stretching is an active form of mobility to increase range of motion. During dynamic stretching, active muscle contractions move the body segment through the available range of motion for a joint. and acute effects of different stretching on static and dynamic balance in female football players, published in the International Journal of Therapy and Rehabilitation, different dynamic stretching methods for the lower extremity are explained. Take a look at the chart on the slide. The dynamic stretches were performed once every second to target the muscles being stretched. Each stretch was performed 5 times without bouncing at 3 different speeds: slow, moderate, and fast. This study showed dynamic stretching resulted in improved static and dynamic performance. There are no published evidence-based guidelines for prescribing dynamic stretching. We suggest that dynamic stretching be prescribed as in this paper, 5 repetitions at 3 different speeds.
There are different approaches to stretching and bodywork in physical therapy. The patient can perform a self-stretch of the upper extremity and lower extremity. Other approaches are patient active therapist assisted, patient passive therapist assisted, and water traction. We'll go through all of these next and explain how to perform each of these in the water with your patient. First, we're going to discuss self-stretch of the upper and lower extremity.
Here we see different pool equipment that can be used to assist patients with their stretches. On the upper left, you see dumbbells that can be utilized to stabilize and provide buoyancy of the patient's extremities while they are performing a stretch. The pool noodles in the middle and ankle floats on the right are also used to help the patient take advantage of the water's buoyancy. Finally, we are demonstrating that you can use the pool itself. You can show your patient how to stretch using the walls, pool rails, or steps.
Now we are going to talk about the many ways to provide stretching and bodywork. Let's start with self-stretching. Self-stretching can be static or dynamic. The PT must teach the stretch and determine the parameters, hold time, reps, etc. They should watch the patient practice and correct errors, make sure the patient is using flotation properly, and teach the patient to monitor pain, quality, fatigue, and tolerance. The advantages of self-stretch are it does not require PT to be hands-on, the patient can be independent, and carryover happens post-rehab. The pictures on the left are me demonstrating a self-stretch that can be static or dynamic. This exercise also acts as a self-mobilization of the glenohumeral joint. The patient can stand with the arm abducted and thumb towards the ceiling. Lower the body by squatting lower down in the water. This will stretch the latissimus dorsi and the inferior capsule. A similar stretch is being demonstrated on the right. Again, start in standing, but this time have your palms down on the wall and slowly lower yourself into the water, feeling a passive stretch in your lats and joint capsule. The pool walls and bars are equipment to be used to assist with stretching. It is important to realize that this stretch can be effective if a patient does not have the strength to actively flex or abduct the shoulder. You might ask, well, couldn't this stretch be done on the land? The answer is yes, but in the water, the patient can use different depths and can be more comfortable raising and lowering the body.
In this slide, I'm demonstrating a similar stretch. In this stretch, I place my hand palm down on the wall and rotate around to feel a stretch of the scapulohumeral muscles in the joint capsule. My left arm is being demonstrated here. Depending on the available range of motion, the patient can go deeper in the pool so that the upper extremity is more in flexion and abduction. This is a good stretch for horizontal motion and it can be static or dynamic. In this video, I am demonstrating the stretch from the previous slide. This is a dynamic version of the shoulder stretch. If I move a little deeper, I could work in a greater flexion and abduction.
In this photo, you can see a self-stretch of the left upper trapezius. Hold onto a railing and slowly perform cervical side bending to the opposite side to feel a stretch. The warmth of the water can encourage less pain and greater tissue extensibility.
The buoyancy of the noodle or other flotation device can also be used to help patients engage in self-stretching. Here the patient would wrap the noodle around the upper body, then slowly abduct the arms and extend back to feel a stretch of the pectoralis and biceps muscles and the shoulder capsule. Squatting or standing can add a stretch at various angles of shoulder abduction, flexion, and extension.
The video on the left is another way to perform self-stretching of the arm and shoulder. Use the dumbbells to stabilize as you slowly lower yourself into the water into a 90-degree squat and come back up slowly as well. In the video on the right, the same sequence is done except for the patient is abducting and adducting the shoulder. The buoyancy of the dumbbells provides stability in the water while performing stretches. This stretch requires more control of the shoulder joint than the previous stretch using the stationary wall. If the patient lowers her body and then holds the arms on stretch, this can be a static stretch.
These videos are examples of dynamic stretches for shoulder adductors and shoulder extensors using water buoyancy without dumbbells. In the video on the left, with the water assisting to float the arm toward the surface, the deltoids are actively contracting to perform shoulder abduction while the adductors are lengthening. In the video on the right, the water is assisting to float the arm toward the surface. The deltoids are actively performing shoulder flexion while the shoulder adductors are lengthening. The person in this video is lean and not injured, but picture for a moment an overweight patient with shoulder weakness. Performing this dynamic stretch in the water will be more effective with the assist of the water. A heavy arm on land becomes much lighter in water.
This is a hip adductor stretch. Use a noodle to float one leg. The opposite leg will be straight and planted on the floor of the pool. You may hold onto the wall for support. As a reminder, frequency of stretching is 2 to 3 days per week, and you want to stretch to the point of slight discomfort or feeling of tightness in the muscle. Stretch the muscle for 30 to 60 seconds and perform the stretch 2 to 4 times per day. The pool noodle can assist with upward force as well as increase or decrease the level of difficulty of the stretch. Placing the pool noodle under your foot will increase the intensity of the stretch. But if the stretch is too much, you can adjust the noodle by moving it under your calf. This will decrease the tension produced by the stretch. It is important to remember that you must teach your patients how to use flotation. Noodles can be awkward to use at first.
This photo shows the right hamstring being stretched using the buoyancy of the noodle to force the leg upward. Remember, our performance indicators are fatigue, pain, quality, and tolerance. Observing these indicators will show how your patient is responding to therapy. Ideally, we want our patients to have no pain, good quality, no fatigue, and tolerance to the exercise, water, and the position we are stretching our patient in. Any signs indicating pain, decreased quality, fatigue, and decreased tolerance to therapy activities indicate the activity should be stopped and adjusted. The needle can be adjusted to decrease the intensity of the stretch. To stretch the gastrocs, instruct the patient to dorsiflex, pull the toes to the nose, and also leaning against the pool wall can help stabilize the lower back.
Ask yourself, what is going on during this dynamic stretch? What muscles are contracting to flex the hip? What muscles are contracting to extend the knee? What would happen if this patient was overweight or obese? In the water, would the leg be easier to move into hip flexion and knee extension? What muscles are being stretched? Pause the video and try to think through this exercise. As he moves the leg up toward the surface, his glutes and hamstrings are stretching. If he performs ankle dorsiflexion, toes towards the nose, he will also feel a stretch of the gastrocs. Dynamic stretching usually involves a gradual increase in comfortable range of motion. This is a very good approach to a warm-up exercise before a more strenuous activity. If the patient was overweight or very weak, the leg would be more buoyant and the water would make the motion easier.
Here I am stretching my hip flexors using a noodle. Remember that the rectus femoris also crosses the knee. The patient can stretch the proximal rectus femoris depending on the angle of hip extension. The distal rectus femoris is stretched more or less depending on the angle of knee flexion. Now take a closer look at this picture. I'm performing a common error that the observant physical therapist will recognize. Can you see it? Pause this video and see what you can find. My lower back is in extension. It would be better for me to have a lumbar spine in neutral. This is a common error and one you can point out to your patients. Pool stairs are a great way to facilitate a gastrocnemius stretch. Have the patient hold onto the handrails and place the metatarsals on the step while lowering the proximal foot to the ground. The lower the heel is to the floor, the greater the stretch. Knees should be fully extended during this exercise. To recruit the soleus muscles, the knee must be slightly bent. The good thing about using the pool stairs is that the patient can be positioned deeper or more shallow depending on comfort. In this photo, I am not fully weight bearing. At the level of the ASIS, weight bearing is 50%.
These are the concepts we have covered so far in this module. Remember, we use the water because it offloads bones, joints, ligaments, increases blood flow, and decreases effects of gravity and weight bearing. We can perform both static and dynamic stretching in the water, and both are beneficial. Use what is best for your individual patient. Pool noodles, rails, steps, and sides of the pool can assist with stretching and body positions. While these are helpful, make sure your patient is using this equipment correctly to avoid risk of injury and ensure they are stretching exactly what they need to be stretching. Keep in mind FIT BP and performance indicators, fatigue, pain, quality, and tolerance as you decide the parameters for your patient and have them perform different stretches. Also, be creative. Each patient is unique and have fun coming up with stretches that will encourage patients and improve their condition. You have a lot of resources in a pool, so do not be afraid to think outside the box.
Here's a chance for you to be creative. This patient is a 73-year-old woman with bilateral knee osteoarthritis who struggles to exercise on land due to pain. She is overweight and deconditioned. What stretching exercises will you use in the water to increase range of motion of hamstrings and gastroc soleus? Pause the video and make a plan. In this scenario, the therapist can teach the patient to utilize the stairs in a gastrocnemius stretch. In this stretch, the knees are straight to stretch the gastrocnemius and bent when wanting to stretch the soleus. Leaning forward will make the stretch more difficult. For a good hamstring stretch in the water, the therapist can teach the patient to utilize a noodle for assistance. Have the patient place the noodle under the ankle of the extremity being stretched. Bringing the leg up higher where it's on the surface of the water will make this stretch more difficult. On the slide is also a reminder of the parameters for static stretching. Take a moment, pause this video, and familiarize yourself with these parameters again.
We are now going to talk about techniques that involve the patient being active while the therapist is assisting. The first technique is called aqua stretch, seen in the upper photo. The second technique is called bod regas, seen in the lower picture. The goal of both techniques is to increase comfortable active range of motion. The two main purposes of this patient-active, therapist-assisted technique are to restore mobility and obtain symmetrical movement. This technique is done by the patient moving and indicating an area of tension where the therapist applies pressure. Following the pressure, the patient moves again. This process can be repeated as much as necessary. With the unique properties of water and the pressure from the therapist, myofascial adhesions can be broken up. Using water, our body can obtain releases faster because when the body is submerged, it is easier to identify and stretch fascial restrictions. The water offers buoyancy to allow the patient to go through range of motion they could not achieve on land. The depth of the water allows offloading of joints and tissues, decreasing patient's pain. The intensity of the technique can be increased with deeper water, ankle weights, and increased weight bearing or increased pressure from the therapist. A session of this can last anywhere from 20 to 30 minutes. The patient should be in shallow water around 3 to 5 feet with a temperature of 82 to 92 degrees Fahrenheit. The therapist may need ankle weights, noodles, neck collars, and floats for extremities depending on the patient. The following patient populations can benefit from aquatherapy: orthopedic conditions, fibromyalgia, and chronic pain with adhesion restrictions. While the normal contraindications are applied for patient-active therapist-assisted, there are some additional contraindications to consider. Those with joint laxity, fractures, post-op repair surgeries, and post-op spinal fusions are not indicated to use aquastretch, and those with osteoporosis, prolonged use of corticosteroid medications, anticoagulant medication, and narcotics are to use this technique with caution.
In order to become certified in aquastretch, you must take an accredited course. This specific course presents the foundations and applications of aquastretch. This particular course is 15 credit hours and will cover the basic wellness applications and progression and provide an introduction to the advanced therapy concepts through case study presentations. Topics include starting positions and grips, how to safely apply stretch resistance using 5 to 15 pound weights to the body in 3 to 5 foot depth water, and understanding intuitive movement. No prior qualifications are required.
The next several stretches will be done by the therapist with some help from the patient. The PT stabilizes the patient's neck. The motion looks similar to a joint mobilization done on land. The therapist asks the patient to play by moving her neck around in all directions. After the PT finds a trigger point, he holds his hand on the tender point and asks the patient again to move her neck, all while the muscle is loosening more. The movement of the head plus the hold on the trigger point aids in the release of the muscle with help from the properties of water. This is a video demonstrating the neck movements discussed on the previous slide.
In this slide, the physical therapist has his hand stabilizing around the scapula and superior shoulder girdle. Again, the patient will first move her shoulder freely while the physical therapist finds a trigger point. Next, the PT will hold the trigger point while the patient moves her shoulder in all directions again. A video demonstration will be shown on the next slide. Here's a video showing what we described on the previous slide.
The PT uses a lumbrical grip on the patient's lumbar region while moving his hands superior and inferior. At the same time, he holds the patient's bilateral lower extremities and moves the patient into flexion and extension. This motion facilitates myofascial release with assistance from the warm water. The next slide will show a video demonstration. This is a video showing what we described on the previous slide.
Here, the physical therapist finds the insertion point of the IT band. The PT puts his thumb on the IT band and wraps his hand around the anterior surface of the thigh while the patient plays in different directions. In these photos and the video on the next slide, the patient moves her ankle in all directions while the PT facilitates the movement. The PT places one hand around the heel and the other on the anterior portion of the proximal talocrural area. The PT is helping to improve ankle range of motion while the patient moves her ankle. Here's a video showing what we described on the previous slide.
Here, the PT helps improve big toe range of motion while the patient is moving her big toe in all directions. The PT holds distally at the metatarsal joint at the base of the first met. The patient plants one foot on the ground and holds onto the wall and will play when instructed by the therapist.
Remember that we have categorized the various approaches to stretching and bodywork. This is another patient-active, therapist-assisted technique. It is called Bad Ragaz ring method. The method is developed in Bad Ragaz, Switzerland. Why rings? It's because rings are used for flotation. It uses the properties of water, buoyancy, and resistance. It takes advantage of the body's natural rotation in the water, provides easy access to the patient's body in 3 dimensions. The therapist can conveniently transition to various exercises without the patient needing to roll on a mat table. The method combines neuromuscular facilitation and active range of motion, and the parameters are as many reps or position hold time as possible while monitoring pain, quality, fatigue, and tolerance.
This is a picture of a therapist working with a patient with a TBI. The goal for this patient with a traumatic brain injury is to recruit the muscles of his right arm, contracting and relaxing the agonist and antagonistic muscles. He is supported in the water by the flotation rings. The therapist places her hand to give him input via proprioception. Using this PNF pattern, she is instructing him to move into her hands actively, performing D1 and D2 patterns. The water provides freedom so that even a small effort is rewarded by the movement in the water. The parameters are, as with any neuromotor skill, the more practice, the better. Instruct the patient to do as many reps as possible while monitoring PQFT.
This video is an example of using Bad Ragaz technique to help a patient recruit her trunk muscles. Flotation is used on the limbs and to help support the neck. The therapist stabilizes the upper spine by placing his hands on her upper torso. The patient actively contracts her abdominal muscles to move herself through the water.
The bottle gauze technique uses both the water and the therapist's assistance. In this picture, the water is supportive of the child and the PT positions him on his side. This position encourages him to recruit his left trunk muscle and stretch his right side. The parameters for this would be for him to hold for 30 seconds if he can. The PT watches for PQFT, pain changes in quality, fatigue, and signs that he is not tolerating well. Here's a summary of techniques for patient active, therapist assisted. This type of bodywork requires that the patient be active. The skilled PT gives assistance and understands specific hand placements and cueing. The water provides support and freedom of motion. To be a good practitioner, the PT is encouraged to attend special training workshops.
Patient passive therapist assisted is a form of aquatic therapy done in warm water around 92 degrees Fahrenheit. The patient is continuously supported while being floated, cradled, rocked, and stretched. With the therapist support and the water's therapeutic effects, patient passive therapist assisted techniques combine movement, stretches, and massage to facilitate bodywork with a range of therapeutic benefits and improvement for the patient.
First, we are going to describe passive stretching. The pictures are of a pediatric patient with cerebral palsy who is in 94 degrees Fahrenheit of water. In the warm water, the child feels a significant reduction in spasticity. Given this relaxation in the water, the PT can easily move her into different positions.
Relaxed by the warm water, the physical therapist is able to stretch the child's arms into full passive range of motion. The effect of this stretching can last for several hours and enable dressing the child without the struggle of tight, spastic arms and legs.
The parameters for passive stretching include frequency, 2 to 3 days per week, intensity, stretch to the point of feeling tightness or slight discomfort, stop when spasticity begins. Time. Stretching for 30 seconds improves muscle activation in the antagonistic muscle groups, whereas sustained stretching for 30 minutes is effective and temporarily in reducing spasticity in the muscle being stretched. Type. A series of flexibility exercises for each of the major muscle groups is recommended.
Watsu and Jahara are two similar techniques for therapist-provided stretching, bodywork, and relaxation. The therapist needs training in these techniques to properly deliver effective treatment. Both techniques use buoyancy, water resistance, and warm temperature. The patient is passive as the therapist moves the body through the water. Water resistance creates drag, causing the limb or trunk to stretch into greater joint range of motion. In clinical practice, Watsu or Jahara techniques might be used as part of a treatment combined with other interventions such as aerobic exercise or resistance exercise.
In these photos, a skilled therapist has placed just enough flotation on the patient so that she can be relaxed. The therapist is moving her through the water so that the resistance of the water bends her trunk. Notice that she is positioned slightly inside lying so that the stretch can be provided to the trunk rotator muscles. This type of passive stretch and the ease of moving in various body planes is not possible on land.
In this video, I'm enjoying a modified version of Watsu. I am passive as the therapist moves me through the water. I have not done this before, so I'm not quite relaxed enough. This is often the case when a patient is learning. With practice and trust in the therapist, this form of bodywork is very relaxing.
Now let's summarize what we learned about patient passive therapist-assisted bodywork. The goal is to increase range of motion and relaxation. Using warm water is important so the patient can be fully relaxed. It is recommended that flotation devices are used, although a very skilled Watsu practitioner with an experienced client may not need flotation. Type of techniques include static stretching, Watsu, and Jahara.
The last approach to stretching and bodywork we are presenting is water traction. Traction is a widely used treatment for low back pain, providing spinal elongation and increasing intervertebral space. It inhibits pain, decreases mechanical stress, and helps reduce muscle spasm and spinal nerve root compression. Since the body is more relaxed floating in the water versus land-based treatment on a table, and there's no friction between the body and the water, less traction is necessary to provide relief, resulting in less stress placed on the body and better overall decompression results. Water traction needs to be performed in deeper water so that the patient's feet are free. Ankle weights can be worn or a weighted belt at the waist. The upper body is made more buoyant using a noodle under the arms. Sometimes patients feel relief from pain by merely using the noodle and letting the lower body hang in the water.
Now it's time to consider some cases so that you can apply these approaches and techniques.
Our first case is an athlete recovering from ACL surgery. I recently had ACL reconstruction using a patellar tendon graft in October 2019. In our first case, like I mentioned, we have an athlete recovering from ACL surgery. Your CI tells you to explain to your patient how to stretch their hamstrings in the water. Pause the video and think about your FIT VP parameters, and then we'll discuss them. For the frequency, you will want to stretch the patients 2 to 3 days per week. For intensity, you'll want to stretch to the point of feeling tightness or slight discomfort. The patient can use a noodle in the water and place the noodle under her ankle for support and a better stretch in the water. Hold the stretch for 10 to 30 seconds. For volume, it is reasonable to perform 60 seconds of total stretching in time for each flexibility exercise. This is the general exercise prescription for stretching and can be used on a variety of patients and conditions, but it may need to be adapted to fit the patient's needs.
Case 2 is a child with cerebral palsy. A pediatric patient with CP may benefit from stretching the gastrocs, hamstrings, wrist extensors, finger extensors, and triceps. What do you think your stretching guidelines should look like? Pause the video to think and then we will discuss. So here's your answer. Frequency, greater than 2 to 3 days per week. Intensity, stretch to the point of feeling tightness or slight discomfort. Stop when spasticity begins. Time, stretching for 30 seconds. Improves muscle activation of the antagonistic muscle group, whereas sustained stretching for 30 minutes is effective in temporarily reducing spasticity in the muscle being stretched. A series of flexibility exercises for each of the major muscle tendon units is recommended as the type. Modifications may need to be made based on the child's functional level, types of associated conditions, and degrees of involvement.
The final case is a patient with fibromyalgia. You are asked to perform patient passive, therapist assisted. Pause the video and think of your exercise prescription parameters, and then we will go over it. So you should have said something like this. The therapist could use the Jahara technique. There are no evidence-based parameters for Jahara. The ACSM guidelines suggest that stretching with fibromyalgia is effective with the following parameters. These are parameters for land-based stretching. For frequency, begin with 1 to 3 days per week and progress to 5 days per week. Intensity, active and gentle range of motion stretching for all muscle tendon groups and pain-free range. Stretch to the point of tightness or slight discomfort. Time, initially hold the stretch for 10 to 30 seconds. Progress to holding each stretch to 60 seconds. The type, elastic bands and unloaded, which are non-weight bearing stretching. For Jahara in the water, the therapist applies gentle intensity stretching holding up to 60 seconds per stretch. Monitor the patient looking for pain, quality, fatigue, and tolerance.
To wrap everything up we have gone over today, we would like to review some final thoughts we don't want you to forget. Water offloads the bones, joints, and ligaments. It improves joint mobility and dynamic flexibility, increases range of motion. The buoyancy and temperature of water can improve the patient's ability to participate in PT. The water can be used with all different age populations. There are 4 different types of stretching and bodywork in the water. Self-stretch, upper extremity and lower extremity, patient active therapist assisted, patient passive therapist assisted, and water traction. Don't forget your Fit BP for stretching and PQFT, but make sure you modify it as needed for each patient. PTs can take special classes to learn techniques such as Aquastretch, Bhadragas, Watsu, and Jahara.
We owe a big thank you to Juan Montalvo and Augusta Health for letting us use the pool and teaching us about patient active therapist assisted movement. Thanks for watching our module on aquatic stretching and bodywork. We hope you can transfer what you learned from this module when working with patients in the water.
This module was developed as part of our doctoral project and partial fulfillment of the requirements for our clinical doctorate in physical therapy. We would like to thank Augusta Health Fitness for the use of their pools during our coursework and during the development of this module.